Hello, good morning. I'm Dr. Yap Boon Tat. I'm the Senior Anesthesiologist from the Faculty of Medicine and Health Sciences. Today, I would like to present my second topic for today regarding Caesarean section. So please have a seat and listen to my talk very well. Caesarean section. What is Caesarean section? It is a surgical procedure of which an incision will be made to the mother's abdomen and uterus to deliver the baby, and it can be an elective or an emergency procedure. This procedure is very invasive and it requires anesthesia so that the mother will not have any pain or discomfort during the entire surgery. So these are various types of skin incision for Caesarean section. It can be vertical, it can be lower transverse, low vertical, the classic upper, or the usual one, which is the phalansteal lower segment Caesarean section. So the one that is usually performed on mothers for Caesarean section is the phalansteal incision, which is at the lower segment of the uterus. These are elaborations of the various types of Caesarean sections. In particular, I'm comparing towards the lower segment Caesarean section, LSCS, and the upper segment or the classical incision method. The lower segment Caesarean section is the transverse incision at the lower segment of the uterus, as it is relatively avascular, as placental bed is away from the incision site. The lower segment is usually less muscular and more fibrous tissues were there, and thus reduces the risk of uterine rupture in subsequent deliveries. And this lower segment does not take any active roles in labor contraction and retraction. It is also an easy access to the presenting part of the fetus, which will promote good skin healing. In addition, it is also easy to repair the wound, as is lower segment, with a stronger uterine scar, because it is at a lower segment. Okay? Because of this, there will be less post-operative adhesions to the bowel and omentum, which is located up there, and the less risk of acute paralytic ileus and peritonitis, which is the infection in the peritoneum or the abdomen. Because of the lower segment incision, which is very small, there will be lesser post-operative pain as compared to the upper segment or the classical incision method. And of course, cosmetically, it is better for the lower segment Caesarean section. For the upper segment or the classical incision, it is a vertical incision over the fundus and body of the uterus. And it is very vascular and muscular layer, okay? Because of the uterus is huge and it's on top, so it cuts through to the upper segment of the uterus, which is very vascular and muscular. As this layer usually are active in uterine contraction during labor, it does not give any access easily to the presenting part of the uterus of the fetus. And because of the large incision and going through to the muscular area, it promotes lesser wound healing method and will have a higher risk of wound rupture, wound adhesions, and infection. And this will also have poor post-operative pain control to this type of incision. The classical incision Caesarean section, the indications are the access to the lower segment is limited due to severe adhesions down there, and during the transverse line of the baby, or the anterior placenta previa, which is adhesion to the lower segment of the uterus, huge fibroid at the lower segment, pregnancy with a carcinoma of cervix, this is also an indication for Caesarean section, and an emergency or urgent perimortem Caesarean section to save the mother's life. Okay, so these are the acute indications of the classical incision method. So this diagram shows the various abdominal layers involved during the Caesarean section, which involve the skin, followed by the subcutaneous tissues, the rectus sheath, the rectus abdominis muscle, peritoneum, and lastly entering the uterine muscles so that the baby can be removed and delivered. This is regarding the innervation of the uterus. It is usually from the hypogastric nerve, which is from the thoracolumbar innervation. Okay, as you can see here. So the uterus is usually from the T10 to T12 level, the innervation. And of course, it from the upper segment around T8 or T6. It can go up to T6 or T8 level. Alright. So usually our anesthesia, especially regional anesthesia, we have to cover up to the T4 level, which is at the level of the nipple line. Alright, so that to promote adequate anesthesia or blockade of the skin incision, alright, throughout the uterus as well, okay, as being demonstrated by this figure. The lower segment Caesarean section, LSCS, is also known as a phalansteal incision. It is an transverse surgical incision at the lower segment to deliver the baby. So as mentioned again, this is the picture showing the various type of the incisions usually made, and we are focusing on the phalansteal incision, which is also known as a bikini line incision, which is a curved one and approximately 2 finger breadth above the symphysis pubis. And as mentioned earlier, it promotes good wound healing postoperatively, less pain, and it is less vascular with lesser bleeding risk. The indications for LSCS can be divided into elective or emergency. In elective, it can be because of maternal request, it can be because of precious baby, fetal macrosomia, multiple pregnancies, abnormal lie or presentation, maternal pelvic deformity. The mother might have had bad obstetrics history previously, severe intrauterine growth restriction, IUGR, and hypertensive disorders in pregnancy. As in emergency, there will be acute fetal distress, eclampsia, preeclampsia, uncontrolled pregnancy-induced hypertension, PIH, obstetric hemorrhage, or an obstructed labor. So these are emergency indications for LSCS. The complications of Caesarean section can be divided into bleeding, postoperative bladder or bowel injuries, poor wound healing, uterine rupture, sepsis, peritonitis, amniotic fluid embolism, poor postoperative pain control, nausea, vomiting, risk of placenta accreta in an ectopic pregnancy in future pregnancies, and the need for future Caesarean section, and the risk of bronchial asthma in their babies. So these are the potential and usual complications of Caesarean section. Alright, so this is the end of my lecture number 2. Thank you, and I hope that you will enjoy my lecture.